WHO, World Health Organization by Julia Moffett and Connor Road.
WHO, the World Health Organization, mission is to build a better, healthier future for all people around the world. WHO is a specialized agency of the United Nations that is concerned with international public health. The health issue of overall global health is important for countless reasons. A few of those reasons being to prevent spread of disease, avoid a national health crisis, and to promote a better quality of life for society in general.
The goal of WHO is to raise awareness and promote a change in the status of international health. The WHO website states, "We ensure the safety of the air people breathe, the food they eat, the water they drink, and the medicines and vaccines they need." Their main focus areas are health systems, health through the life course, non-communicable and communicable diseases, preparedness, surveillance, and response, and corporate services. WHO's constitution, which was put into place in 1948, states that the campaign's objective is the attainment by all people of highest possible level of health. The goal of WHO is to promote equal opportunity for all people in regards to living their most healthy life.
WHO's headquarters are in Geneva, Switzerland. WHO works with 194 member states with over 150 offices located across 6 regions. Their target audience is all-inclusive. Their multiple campaigns have reached all ages, genders, and nationalities. Their target audience is masses that care about health issues in general, as well as groups who are or have been negatively affected by the issues WHO is bringing attention to.
One of the strategies used in their campaign is the appeal to empathy, because they include pictures and statements from children and adults alike that are suffering firsthand from some of the worst diseases in the world. Another strategy they use is removing barriers, because at the click of a button, anybody with access to internet can learn all about a particular disease and how to detect and hopefully prevent it. The last strategy that they use is publicity and media coverage. Because of their presence on all of the main social media platforms, since they have millions of followers on each platform that they use, they can reach different demographics that suffer from diseases particular to their regions at the click of a button.
2 more strategies the WHO campaign have used are the problem solver and bandwagon approach. WHO has brought countless health concerns up in their various projects. On their website, a viewer can click on a link that grabs their attention. That link will then direct them to a page where information about the issue is laid out clearly. From there, the viewer can continue to read about the various steps WHO is taking in order to improve the status of the issue. The site continues on to include success stories of people who followed the guidance of the WHO campaign. Their site sometimes even includes exact information about the number of people following the campaign. The use of these strategies makes the viewer feel like the problem at hand isn't too big to invest their time in, as well as promoting the idea that many people are already taking action, which in turn makes the audience less hesitant to get involved.
The World Health Organization uses a myriad of tactics in order to promote healthy behavior throughout the world. Around the world, their crest that is shown in the bottom right of the slide is well known due to their involvement in many poorer countries that are affected by diseases that we in the United States could not even imagine contracting. Their crest is extremely well known due to the promotion strategies prevalent on all of the main forms of social media, such as Twitter, Facebook, and Instagram, where they have millions of followers combined. More specifically, they publish articles which, for the most part, if not always, include statistics and anecdotes from doctors about the subject that respective article covers. The way they present their statistics is very beneficial to their target audience because it is not overcomplicated. They present facts about a particular disease, which is subsequently followed by the symptoms, transmissions, and prevention. This is a powerful way to distribute their knowledge because it is easy to understand and very straightforward, unlike some other health campaigns which pollute their content with confusing graphs. We would not do anything different because, as you will see in the results, what they are doing is working tremendously well.
WHO has been overwhelmingly successful since their establishment in 1948. WHO is responsible for the World Health Report, the World Health Survey, and the existence of World Health Day. They played a major role in the eradication of smallpox, as well as improving the status of many communicable diseases such as HIV/AIDS, malaria, tuberculosis, and Ebola. They have also improved the culture surrounding non-communicable diseases such as sexual and reproductive health. WHO has brought awareness to issues like food security, access to clean water, and air quality that affect millions around the world. They teamed up with UNICEF, Gavi, and the Vaccine Alliance to bring life-saving vaccines to millions of children. The list of successes accomplished by WHO is never ending. However, one of their main successes is the following and involvement that they have received worldwide for over 70 years. WHO has promoted good health and equal opportunity for countless people, and there is no signs that the progress WHO is making towards their goals to stop anytime soon.
Here in the United States, we are lucky that we are supported by many policies that ensure healthy behaviors for the general public. However, in many other countries around the world, they do not have the same support that we do. This is why WHO has taken it upon themselves to be that extra support that some of these countries cannot provide for their citizens. Also, the way they go about promoting awareness and comfortability in a straightforward manner has been proven to be very successful in the results of their multiple campaigns. The easy access across their media platforms is very important to attract people who have concerns with seeking help because at the click of a button, they can have all the information they need about their respective disease. Finally, if you are even in the slightest bit worried you might have a particular disease, or even if you're just curious, go check out their website and learn something that could one day save your life or someone close to you.